So I'm going to start with basically talking about where Satyajit left off. He talked about profits, what we are at the moment, how the profit making angle is taking over, and also this kind of competition. My vaccine is better than yours, or in fact, what is more interesting today is also which countries are pursuing what vaccine ends. And therefore, it's not simply profit-making companies that we are talking about. We're also talking of countries which seem to be pushing certain vaccines and also pushing out certain vaccines. So it's become a part of capitalism and what is being called as vaccine nationalism. And I'll come back to the last point, that there is also a geostrategic battle which is going on with regards to vaccines. Now, very simply put, I think the WHO Director General just a few days back has said the scenario or the distribution of vaccines today is grotesque. It's morally irresponsible that some countries are in a position to vaccinate their entire population within 6 months, as they claim, and other countries by that time would have received very few vaccines or none at all. About 70 countries in the world today don't seem to have got vaccines, or if they have, only very few doses. And you have about 20-25 countries which claim that they have enough vaccines that they will be able to vaccinate their population in another 3 to 4 months or 5 months. Of course, European Union, which seemed to have blocked a large number of vaccines, is not doing well because of various reasons, but that taken apart, if you see how many doses the rich countries have blocked, there are at least 200 to 400% quota of vaccines they have blocked. And even if they don't succeed in the next 3 months, at least over the next 6 months, they probably will be able to vaccinate a very large number of their people. Now, if you look at, for instance, what would be called the least developed countries, or those countries which are at the mercy of essentially what is called the COVAX platform, and I'll come to that in a minute, of WHO, Gavi, CEPI supported platform. If those vaccines don't go through the COVAX platform as it was originally thought of, then these countries, or a large number of these countries, are unlikely to receive any vaccines at all. If we look at the way the vaccines are being released for the COVAX platform, which, as I said, was a WHO platform meant for countries which were not able to get vaccines for themselves or didn't have the money. It was supposed to be subsidized or paid for by a large number of global donors. If we take that platform, it neither has the money nor has it been able to secure vaccines at the rate it thought it would be able to. And in the next 3 or 4 months, it will be lucky if it gets about 200 to 230 million doses. So you are facing a scenario in which some countries are able to vaccinate some people, large number are not. If we look at the way the supplies are taking place, it's probably likely that this would take to at least 2024 or 2025 before you are able to vaccinate the global population. And if I listen to the undertone, what Satyajit was saying, it's possible that we will need a new schedule of vaccinations by that time, because within 2 years, you might need to vaccinate people again because the virus would have changed or your antibody levels in the body would have fallen. So you might need a further booster dose at that time. So effectively, what you're going to see is the epidemic continuing in different parts of the world because we refuse or we are unable as a global response to vaccinate all the people in the world. We are only pretending, or what the United States called the emergency aircraft cabin pressure drop model, that we put vaccines like oxygen masks on ourselves, then help others. But unfortunately for the world, vaccines are not something which will protect your country by itself. if the epidemic is there, new variants are likely to emerge. It is not possible that the global epidemic will cease or it will not cross into other shores only because a certain section of the population in that place has been vaccinated. So this is the crux of the issue, that unless you vaccinate the global population within the next 1 year, say, you are likely to see the continuation of the epidemic in different forms, and you might also see the emergence of new strains of virus, which might need new courses of vaccines. I would also like to now talk about the two other consequences of this. First, of course, is why is this happening? And clearly, the problem we have is that certain countries have blocked vaccines for themselves. This is being, they are able to pay higher prices. And as Satish has already talked about, the profit motive is driving these companies. Therefore, these vaccines are reserved for those people who can pay and those people who can't. The second part of it, certain countries have vaccine capabilities within their shores. India is a lucky one. We have 60% of the vaccine production capacity in the world, and that in terms of volumes, and that obviously is a leverage that Indian government has to say it needs at least 50% of that vaccine that is produced in the country for its own population. And the other 50% can go outside, depending, of course, on how long or how much vaccines we can push to our people, how much is available to others, and so on. But if we take that portion out, most of the countries are not in the Indian state, not in India state. They don't have vaccine making capability. Large numbers of them, in fact, do not have vaccine making capability at all. And given that, what is happening is they're dependent on others. Now, I'm not going to talk right now. I'll come to this point in a minute. Why is it that we cannot really increase our vaccine making capability? I'll come to that in a minute. But what is we're increasingly seeing is that certain countries believe that if they protect themselves, then their economic recovery will take place. They'll be hunky-dory. They will take the rest of the world. The problem that they have is, unfortunately, the global economy is interconnected. And if certain parts of the globe continue with the epidemic, their economies don't recover, its effect on the rest of the world is also going to be there. And this is a strange scenario where you have the IMF and the International Chamber of Commerce telling the rich countries that if we look at what is happening, a global recovery is important for even your economies to recover. And if there is no global recovery, you will not be able to sell your goods to others. Therefore, you will have no recovery either. Therefore, if you do not invest in vaccination for the rest of the globe, their economies will not recover, neither will yours. And this is going to cost you, they have calculated anything up to $5 trillion is what the rich countries will lose if they do not help in vaccinating the rest of the globe. Now, that unfortunately has made no difference. As far as the rich countries is concerned, it really does not matter, because they think that if they isolate themselves from the rest of the world, they will still be okay. And the kind of linkages which people are talking about in terms of supply chains, markets, where will they sell their goods, where will they buy all the supply chain requirements. Remember that United States and Europe are no longer the major manufacturing centers in the world. Where will they get the things that they think they need? Can they produce it in their countries? All these questions, this is what they seem to show. The idea is a very national, parochial vaccine nationalism seems to be taking over the world. And if you can guarantee vaccines for your own people, it really doesn't matter. Of course, we have very ugly spats taking place between European Union and UK at the moment, that our factories supplying your vaccines and your factories are not supplying our vaccines. All this is going on. But behind this is the other picture, which we also seem to be oblivious about. And that is that we have vaccine making capability far beyond what we are at the moment putting into play. Why is it so? Number of vaccine makers, their vaccines haven't taken off, they didn't succeed. So those at least capabilities are idle. There is, for instance, in India, there are at least 10 to 15 vaccine makers who are able to make large quantities of vaccines, who are waiting for various clearances or for technology or trying to tie up with partners. Some of them are tying up with partners, some of them have not succeeded. Now, these would then require technology to be available freely for them to be able to then provide the vaccines. Now, if that is to be done, then it needs a relook at how technology of vaccine making is shared across the globe. And here Satyajit's point that he was raising comes into focus, that if it is intellectual property, and it is not simply the question of patents, patents can be busted. But when you make vaccines, there is a lot more to it, just the question of patents. That means you need certain technical know-hows, you need process knowledge, which is all intellectual property, but not patents. So the question is, are these being shared? And the answer is no. And those companies which are in the forefront of the technological innovation, the so-called mRNA vaccines, have said very clearly, our vaccine is for profit. This is how innovation happens. Of course, innovation happens because of public funding, government funding in all these vaccines, but that's not what they're putting on the table. And therefore, these are for-profit ventures. We do not intend to share our technology or know-how with anybody else unless they pay us monopoly profits. So this being the bottleneck, of course, India and South Africa have moved in the WTO that these should be shared. This has had obvious opposition from the rich countries, the European Union, the United States, Japan have all opposed it. And their argument is, no, this is how we will damage innovation. In fact, the only way to help new innovation is to make them make monopoly profits, even if the global economy is going to be not facing a recovery for the next 3-4 years, and even if millions of people die. Now, this is a rehash of the AIDS epidemic, so I'm not getting into this, but this is the intellectual property debate. We have the capacity, we have the ability, we have the manufacturing capacity in the world to produce the vaccines we need. The fact that we are not doing it is primarily what we see as helping innovation of big pharma to succeed at the cost of human lives. I'll end with the last point, that unfortunately the vaccines have also become a part of a much larger geostrategic battle, as the United States and European Union is tending to decouple with China and Russia. And you have completely one-sided various sanctions being put on China and Russia on various counts. The Islamophobic United States, which has attacked 7 countries in the last 10 years, is now pretending to be the champion of Islamic for the Muslim community, Uyghurs in China. All of this is actually illegal in terms of international law. All of these sanctions are essentially one country trying to sanction the other, and this is not as per the United Nations framework that we had set up in the world. This is not how sanction regimes should work, that a country should use its financial clout to sanction other countries. But when it comes to vaccines, the issue is it's to keep Russia and China vaccines out of as many countries as they can. A lot of it is collapsed because of vaccine hoarding by the rich countries, particularly the United States and European Union, and of course, UK. There is now a turn to Russian and Chinese vaccines, particularly in Latin America, in Eastern Europe, and also in Southeast Asia. And therefore, you can see with the Quad talks trying to get India to supply the rest of the world, because AstraZeneca, Serum Institute, and Serum Institute is the largest vaccine maker in the world. So if they line up with the the United States, the geostrategic vision would be that, okay, we will take care of the rich countries like India, take care of the poor countries. Let's both try and keep China out of these markets as much as we can. And Russia, of course, is a player today in Latin America and Eastern Europe. And that, of course, is not in direct conflict with India because we don't seem to have that as as a competition. But nevertheless, with AstraZeneca, with Johnson & Johnson trying up with biological E in India, there is that angle also developing. And it's a little surprising that while the Gamaleya Sputnik 5 vaccine has been in the table in India for quite some time, why we have not sanctioned it or why we have not given it emergency use clearance, those questions we are not aware of what the reasons are. But there are at least 500 million doses of Gamaleya Sputnik 5 vaccines, which can be manufactured in India, can add to either India's vaccine program or to the global vaccine program if these clearances are given and this manufacturing starts in India. So I will stop here to say that the vaccine issue is just not about vaccines or the biology of the disease. It's about much more than that. Unfortunately, it's a part of the political economy of the globe, and it has also entered what I would call as the geostrategic parts of the battle that is ongoing at the moment. I think I'll stop here and hand it back to Vikas or Jason, whoever is able to take the mic.
Vikas is